30 on a Thursday night, 11:30 Eastern Standard Time. So, yeah, better late than never. I think that with this new entrepreneur life, I my sleep schedule is definitely a little bit shifted. So I tend to wake up later, but I tend to fall asleep later too, which I personally prefer. I really do like that. It works very well with my natural circadian rhythm. I've always been the type of person who naturally like to fall asleep around 1 a.m. and wake up around 10, or fall asleep around 12 and wake up around 9. Like that's perfect for me. I if I wake up early in the morning, I do enjoy that clarity that I feel early in the morning, but I don't like getting up early in the morning because then I have to fall asleep early. But then if I fall asleep late and I force myself to get up early, then it's just not enjoyable. And then you have to down the coffee to be productive, and then you just kind of chase this cycle again. So I'm definitely not the biggest fan of that. But we got some exciting news actually. So tomorrow we are going to APA, so the American Psychiatric Association. So that's a conference. It's in LA. It's going to be going on for 5 days. So very, very excited for this. Going to be a lot of networking at the conference, meeting other psychiatrists, people in my field. I'm giving a talk there. I'm giving two talks actually. One's a collaborative talk, but the other is my main talk. It's a solo talk by myself. So yeah, I'm very excited for that. And these conferences are honestly I was telling my buddy, they're just almost a giant party. Like everyone gets together and you attend the conference and you do stuff at the conference, but then all the networking and all the connecting, all that happens after hours. So there's happy hours and dinners and all that stuff. I went to my first conference last year, and so I went to a Northwell Health meetup. That's where I did my child adolescent fellowship. So they held the meetup, so I went to that meetup. So that was one thing, and for the APA, and then a genetic testing company also took me out, so I did that as well. So that was the second thing. So those are the two that I went on. I think there's maybe one more that I'm forgetting. And I connected with some creator, and I had dinner with one of the creators that I knew there. So yeah, pretty much just multiple connections through that route. And yeah, why don't we just get into it? Can ADHD medications cause make akathisia caused by LAI? Can ADHD medications mask akathisia? Yes. So clonidine and guanfacine can, but not the other one. So yeah, that's the only one that cannot. Or sorry, clonidine and guanfacine can, but the others don't mask akathisia. How do I stop taking Zopiclone? I'm not sure. You could just stop it. But ideally with most psych meds, you want to taper off of them slowly. What are your thoughts on 300 at 10 a.m. of Wellbutrin and then 150 at 12 p.m.? That's fine. Yeah, it's no problem to split it up like that. You basically just want to make sure that it's not close to bedtime. That's the main thing about it. Tell me about Trintellix. Yeah, basically it's a antidepressant. It's one of the newer ones. I think of it like a designer SSRI, and it's good. It tends to have lesser side effects for weight gain and sexual dysfunction than compared to the others. So I do like that benefit as well too. Only downside is that it's expensive, but it also tends to have some extra anxiety benefit too. Think of it like a buspirone combined with an SSRI. But the best medication for rage, so I like guanfacine and clonidine to start. Those are more milder ones, and then risperidone for more severe stuff. Yeah. Hey, Dana, good to see you. Good to see you. Curious your age. Yeah, curious your guesses. My ex had BPD. Do BPD people have empathy? Yes, they definitely have empathy. It's more that they lack a stable sense of self, so they tend to attach onto others, and they also tend to attach onto their emotions strongly. And rather than being able to like weigh their emotions in a more grounded light, they tend to follow the wave of whatever emotion is they're feeling right now. And so empathy can be a strong one that they feel for sure. But then they can also feel rage strongly too. I take 500 milligram of L-theanine. Sometimes it doesn't work. Sometimes it does. Yeah, it just depends on your how much anxiety you have going on. I am on Vyvanse 70 milligrams. I don't feel anything. Know why? You could be a fast metabolizer, or your tolerance could be super, super high too. What do you suggest for studying for the PMHNP boards? That's a good question. I've never took the PMHNP boards, so I don't know that. But actually, members in our community might know. So that could be a good question to pose to them as well. If you want to. But so my community is dedicated more towards teaching PMHP psychiatry, like real world psychiatry, not like board stuff, but actual real world application, real cases, real medications, right? Real uses of them. Discussing, for example, my students would do a weekly Q&A call, and they'll share with me, okay, like this is the like the case that's going on. Like I have an autism kid with irritability and aggression. How do we treat him? But there's also ADHD, so we work on those cases together. Because they'll ask me that. So that's what's going on there. How do you de-stress from work? How do I de-stress from work? Work is my life, so I love work, so I don't need to de-stress from it. It's very, see, I think that most people have the wrong idea. It's like, okay, there's work and then there's life, right? Like, but I remember when I went to an interview for a psychiatry residency, and she was like, I asked her about work-life balance, and she's like, well, for me, she was a forensic psychiatrist, and she's like, for me, work and life are integrated. Like, work is part of your life. So rather than having this be two separate identities, it's like it's an integrated aspect of it. And I really do agree with that. Work does integrate with life because you're accomplishing something, you're trying to achieve something. And so for me, I realized that I can't really, when I work for other people, it's definitely a lot harder to do that, but I try to find value in the work. I try to find value in the help that I'm giving, but also in the improvement that I'm making too. That's what gives me the biggest satisfaction, is constantly getting better and better at my skill set. Like that's what I really enjoy about working. And so now, especially that I'm working independently, I work, I'm working on my business, working on my psychiatry skill. And so for all of that, I don't really take like work and life balance or like de-stress from work. Like all of it's kind of tied together, and it's fun for me. Like I really do enjoy it. Trazodone and flecainide. I don't know what flecainide is. How do you treat OCD? So you can use N-acetylcysteine. N-acetylcysteine, you can use high-dose SSRIs and exposure therapy. Well, you're speaking from privilege there. Not everyone is in benefit of embodying their values, but it's all about mindset, my friend. See, this is what we call a victim mentality. You're speaking from privilege. I hate when people say this, because everyone is born with certain things and everyone's born with certain lacks, right? So, for example, I was thinking this the other day. I don't know if you've ever seen that morning routine video of Ashton Hall, right? The one that went viral. He dunks his face in the premium water. I will never be as ripped, as jacked, as athletic as that man. He could stop working out for the rest of his life, and I could dedicate my life to the gym, and I will never achieve his physique, ever. But that doesn't stop me from saying that, oh, like, that man has jacked privilege, right? No, I still work. I still go to the gym and still exercise for my own improvement, my own health. So similarly, you can always embody your values. You can always make a change. You have to work at it. It's not like it just magically happens. Do you believe that your environment has a strong impact on your mental health? Of course. Of course I do. Yeah, I of course I do. Environment's huge. It's always nature versus nurture. Do you work somewhere today? Yep, working the game, you know. We're working right now. Every day is a chance to work. Are you married? Married to the game. What else does lithium help with aside from mania? It's mainly mood stabilization. That's the biggest difference. It helps with mood stabilization, and it can help with some depression too. That's the main stuff that it helps with. But bipolar stuff, not really. I wouldn't use it for unipolar depression. Good evening. Yes, good evening, Sheena. Welcome. Is there such thing as working out too much? Yeah, of course. That can be an addiction as well too. Definitely a better one, but you just don't want to get underweight because then you can develop an ED and then there's problems with it. Yes, and also, so if you get psychosis, that can be bad as well too. If psychosis lasted for a long time, can really cause deterioration in people's brains, especially like if it's like a schizophrenia or a chronic psychosis. So you want to get psychosis treated ASAP. What does it mean when a med goes past blood-brain barrier? Basically, what that means is that it will go to the basically you have the bloodstream, right? You have the blood vessels, and then but to cross the brain has a defense, so that way the infections and other things can't cross to enter the brain because the brain getting infected would be very bad. So there's a blood-brain barrier, and so medications are designed. Some of them are designed to go through the blood-brain barrier, so that way they can actually affect the brain, right? Like SSRIs and things. So that's what it means to cross the blood-brain barrier. How does psychosis deteriorate the brain? I mean, basically, it's not a normal condition. It's you have an excess of dopamine, and that causes damage to the brain. Also, just behaviors that you do when you're psychotic. You could hurt yourself, hurt someone else, do some risky things, etc. Also, please don't spam. It makes me much less likely to answer your question if you spam like that. Also, yeah, the best way to get your questions answered, so consider subscribing, because if you sub, then it will prioritize your questions a lot more. So what makes Lamictal different from lithium? Can you take both together? Yeah, you can take both together. Lamictal just addresses bipolar depression, whereas lithium addresses the mania side of things. So you can take them together, but if they have more bipolar 1, then lithium is what your go-to would be first. Evelyn says, best treatment for acute psychosis and aggression in the elderly residing in nursing home. Yeah, so we actually had this call in my coaching program just 2 weeks ago. So one of our members, she works in a nursing home, so she's a PMHNP. She's been there for like 2 years, and she asked about an elderly patient in the nursing home who has similar issues. So she used this thing called it's like this gel that you put on, ABH gel, and that's what they had. So it's like Ativan, Benadryl, and Haldol gel. So she used that. Benadryl's not ideal in the elderly because of anticholinergic, but that's all they had. They didn't allow antipsychotics at her thing. But normally you would use antipsychotics. You'd use something like risperidone. Quetiapine is also used. Those are the ones that you want to use. You want to avoid stuff that has too much anticholinergic burden. So Zyprexa is a no-no. I mean, it's a no-no, but it's just less likely or less used. Quetiapine would be also no-no. Haldol you could also use too, but then that has a slightly higher risk of QTC prolongation, so I would limit that one. So risperidone and Seroquel are usually the go-tos for nursing homes. Also, of course, like non-pharm interventions like reorienting them and stuff. But if they're psychotic, if they're sundowning, then risperidone's like the go-to. Depakote, you could use Depakote as well. That's true. But oftentimes, for example, in that patient we discussed in my coaching program, the patient had liver function elevation, so Depakote was not a good one too. The nursing homes give bonuses to not use antipsychotics. Interesting. See, that's where the finances of healthcare come in. Abilify could be used too. Yeah. Thoughts on red meat diet and real greens like asparagus, broccoli? Yeah, I'm a big fan of like a carnivore diet, low carb. That's what I eat normally too. Like today, I had a whole bunch of salmon, um, and some veggies, and had a protein bar. Yeah, that's pretty much it. And then a little bit of like Indian sweets. We call it burfi. My mom went to India like a month ago, so she brought some back. But that's all I had. Yeah. So yeah, but I'm a big believer. Like I make the core of my diet just meat and veggies. Like that's the foundation, and then nuts too, and then everything else kind of like falls this. I love salmon. That's what I eat. I eat salmon every single day. If I can, these omega 3s, you gotta get those omega 3s in your system. How often do you see the lamictal induced rash in your practice? Pretty rare. I've never seen it, but like I know it's a thing. Like I've seen a little bit of rash, sorry, but I've never seen Steven Johnson. I experienced psychosis after trying to cold turkey from ETOH. This is back in 2021. Yeah, that sounds like a withdrawal effect. That's not really psychosis. I mean, it can be, but that's more serious withdrawal. Usually that will go away over time. How often have you seen DID? I've seen one or two cases of DID. I haven't seen like a gazillion, but I've seen one or two. Um, I remember this one I saw. It was a lady who was in like a 16, 17-year-old girl. And so she was in the inpatient psychiatric unit, the adolescent unit, because she split into this personality where she was she was a rabbi. She was a rabbi from like the 1800s or something, and she spoke that way, and she would wear her full like religious gear, and she had the yarmulke on, and like this was like a thing that she was under, and like she would act this way the entire week, and it took a week to kind of snap her out of it. And the parents would say, yeah, this is something that she does from time to time. How do you know they're not faking it? Yeah, well, that's why you watch them over time. It's not like you watch them over time. You watch their mannerisms. We had her in the inpatient unit, and oftentimes it can be a trauma response. So I do believe it's a real thing. I mean, I think that TikTok is like exacerbating it. Like a lot of people are like self-diagnosing and stuff. But there's been a couple of cases I have seen. Have you watched the movie Split? I have seen Split. Yeah. I never saw the third one, Glass, but I did see Split, and then whatever the first one was. I forget what the first one was. But yeah, yeah. Hey, yeah. It was good. It was good. But I don't remember if how much of the multiple personality stuff was real or not. I just don't remember. It was a while ago. If Haldol is necessary, are arrhythmics given if QT elongation happens? Yeah, that's when usually cardiology would come into play. Uh, yeah. So that would be a cardiology question. I'm not sure, but probably, yeah. Unbreakable. Oh yeah, that was the first one, right? Yeah. Tips for pre-shift anxiety as a new nurse. Um, develop confidence. Basically, like go in with humility, expecting to learn as much as you can, because that anxiety will go away with exposure and confidence and competence that you develop. That's the key there. So, can you speak on PMDD? Yes, so that stands for premenstrual dysphoric disorder. That is a condition where a lady will experience a especially 2 weeks prior to the period, she'll experience a lot of mood symptoms, and it's really distressing for these patients. And so I remember I had one lady for it, and the way we treated her was we used Lexapro 10 milligrams during the phase 2 weeks before the cycle. So it's called the luteal phase, and then after that we used Lexapro 5 milligrams. So we'd alternate between 5 and 10, and that really made a big difference for her. So that was really good. And yeah, there's also other things that you can use too. There's like a bunch of supplements that you can use, like calcium and stuff for PMDD. And the reason I know this is because I literally just made a PMDD lecture maybe like a week ago in my coaching program. And so yeah, that topic's fresh in my head, and a lot of my students have asked me about it too. Is it okay if I talk to myself a lot? Yeah, I talk to myself too. Do you recommend going above 2 milligrams a day for Risperdal for the elderly if they have acute psychosis? Uh, there's so this is something I teach my students as well too, is that there's a difference between real world psychiatry and textbook psychiatry. So real world psychiatry is textbook psychiatry is like, no, you can't use above X or Y milligrams. For example, with Adderall, the FDA limit is 60 milligrams per day, so you can't use it. Well, I have a patient who's a fast metabolizer. I have him on 30 milligrams 3 times a day, and he's doing fine. He's doing great. He just has a high tolerance and he's a high metabolism, so he needs it to function. He's an entrepreneur. So similarly, with 2 milligrams of Risperdal per day, I mean, it's not ideal, of course, but some patients, they will need it, and they might be more resistant. Their condition is more severe, and with every medication, what you're trying to do is you're trying to balance benefits versus risks. And if the benefits versus risks are greater, then you should use it, right? So in the elderly, especially if they have acute psychosis, they're a danger to themselves, they're a danger to other people, then you certainly could go above that 2 milligrams. You don't want to limit a dose just because of arbitrary rules if it could help the patient. All right, what is your coaching program? So I run a coaching program teaching Psych NP psychiatry, and basically about a couple months ago, I started going live, and I had a lot of NPs reach out for questions. They were like, "Hey, can you explain this medication or explain this diagnosis, or how do I treat this?" And I got a lot of requests for collaboration, for precepting, for teaching and mentorship. And so I was like, you know what, like there's a big need here. And so I created the program to teach what I've learned in residency and fellowship to you. And so something that my students have told me is that they felt like they weren't really taught that well in Psych NP school. They felt like their jobs didn't really teach them that well. They were overwhelmed with patients. For example, one of my students literally just quit her job. She resigned because she's like, they just kept piling on patient after patient, and I was taking advantage of, and barely got any collaboration time. And so I realized that, okay, this is a big problem, that people aren't teaching NPs, and so a lot of my students said that they felt like they weren't really confident in their roles, and so that's why people are joining, is to build that confidence by building that clinical skill. So the best way, if that interests you, is the best way to do that is you can just send me a message here. Yeah, that would be the best way to do that, or you can check it out in my bio. Do you teach about private practice as well? Yes, so I have started my own private practice. Yeah, so that's something I'm going to go into. But I also have a friend as well who has her own private practice academy. And so I learned a lot from her too. In fact, we're actually going to be linking up this weekend at APA, American Psychiatric Association, to see if we can do any kind of collaboration between our communities. Because I teach the psychiatry aspect of things, and she teaches private practice and building that aspect. So I think combining the two is really where we're going to get the best combination. So that will be in the works as well. We're going to be integrating a private practice teaching component into the program, because I think it's super important that people learn the skills to develop their own practices, for sure. I mean, developing my own practice has enabled me financial freedom now. Like, I work for myself. I have no employer. Like, I do a side gig, but that's very minimal. I have no full-time job. Like, this social media is literally my full-time job. Social media, entrepreneurship, business, and my private practice. Like, that's my full-time job. And learning that it's given me so much freedom. I can wake up whenever, I sleep whenever, and that I can completely in charge of my own schedule. I can schedule my patients whenever. I don't have to put in a whole bunch of people, and I can serve my patients better too, because now, like, for example, my evaluations, I spend 90 minutes as opposed to like 20, 30 minutes per patient. So I spent 90 minutes on each follow or each eval, and then 30 minutes on 30 to 60 minutes on each follow-up. So that's the difference that you get with the private practice. So it's definitely a skill set you want to learn if that interests you. Thoughts on Tony Soprano, Psychiatrist? I've never watched I've never watched The Sopranos, but Psychiatrist I did like in the show was Billions, like the whoever the lady in Billions was. Basically, she's a Wall Street investor, and she helps the Wall Street guys make better bets and deals, and that makes such a difference, because that mental confidence you need can be such a huge game changer between making like a $5 million deal versus like scrubbing it. So I always thought that was cool, like, oh, she's a Wall Street psychiatrist. Would you feel comfortable talking about what medication you take? I only take hair loss meds. I don't take any mental health medications. I take hair loss meds. How much research did you do to match Psych? None. Hey, my wife Jerry Psych, and she's starting private practice. Where should we go to learn to start? Send me a message. I will send you a link. I'll send you a link to a good resource. You look sleepy. Take some time and get some sleep. Nah. We're hustling here. I'm not sleepy. I feel good. Yeah, we're hustling. We're always hustling and working. I'm a private practice owner as well. SLP. I get about 8 to 9. Can you be my collaborating physician if I'm an NYC? So I only take collaborating physician requests from my students, because then I get to know them better and I get to work with them, right? It's not fair to my current students in my coaching program if I take collaborating requests from people who are not part of my program, because my allegiance and my loyalty is to my students first. Difference between SSRI. Oh, rip, these questions are forming. I deal with grief on a daily basis. Do you know where I can get a certificate at? I'm not too sure, to be honest. TY, yes. Pathological attachment, please. Is there any difference between a Psych NP and psychiatrist job description? Yeah, well, they pursue different paths. A Psych NP goes to nursing school first and then becomes a provider. A psychiatrist goes to medical school first, then does a psychiatric residency. Can someone in psychosis come out? Yeah. If there's brief psychosis where they can come out maybe just on their own, if there's like a stressor. There can also be psychosis caused by infections and some medications like steroids or other medical conditions like lupus. And then there's psychosis from bipolar and schizophrenia that need antipsychotics to treat. Did you have diffuse thinning or something? Finasteride holding up? Yeah, I definitely had a lot of things. If you go back to if you just keep scrolling, you can literally watch my hair journey. So I got a hair transplant about a year ago. And so you can go up to like February 2022, so you can see where my hair was thinning, and then where I got my transplant, and then now how it's grown since. So you can literally track that whole journey. Is Buspar really a useless drug for anxiety? I think it's like mild to moderate. Mild from anxiety. It's not like a amazing one. Do you use LAIs often? I mean, not now, but because I work in private practice, but when I did my prison stuff, that's when I used LAIs. We use it in the prison, and I did a lot of work at the community mental health, and that's where we used LAIs a lot. Why do you have rubber around your glasses? Because you always use protection, my friend. Hi, I have a question. I've been prescribed duloxetine, Wellbutrin, Excel, Vyvanse. Would it go together fine? I would not be into that combo because that's a lot of stimulation. Duloxetine is norepinephrine, Wellbutrin stimulating, Vyvanse stimulating. I mean, it depends on the patient. Do you believe in psychic medium abilities? Do you only think on a scientific standpoint? I mean, I see your bio, right? So I understand where your perspective is. For me, my belief is that basically there's different systems and different ways to view the world. Science is just one way to view the world. Religion is one lens to view the world in. Spirituality, psychic, medium abilities, that's another lens to view the world. And all of these lenses lead to different truths. And there's a universal truth of the world, but there's just different ways to interpret it. And so I think that people just develop different ways to interpret the truth of the world. And psychic medium abilities are one of them, because it helps a lot of people. So like a lot of people believe in it, and that's what gives it power. Just like with money, I remember learning this in accounting class, and it blew my mind. It was like the only reason that money has power is because we all believe in it. Otherwise, like right, like a dollar bill is literally just paper. It's just paper. But because we all believe in it, that's what gives it power. Thoughts on Geodon for PTSD? It's not my favorite. I mean, it's not really meant for PTSD. I would prefer something a little bit more calming, like Seroquel, because that helps with sleep too. Is there a better option than fluoxetine to not feel like a zombie? Yeah, different SSRIs affect people in different ways. How are SSRIs different from modulators like vortioxetine? That's a good question. So, and in fact, this is actually something I cover in depth in my coaching program, because I go through all the mechanisms of action of all the different antipsychotics. So, actually, here, let me just share it with you. Fuck it, Rip, yeah, we're going live. We are going live here. So, let's see. Let me show you. So, for example, now we're looking at the program, right? So we go to psychopharmacology, and what were we talking about? So you said SSRIs versus vortioxetine. So if we look at SSRIs, those mainly just stimulate SSRIs in general, like serotonin release in general. So all an SSRI will do is increase serotonin in the serotonin transporter, and just increase a whole bunch of serotonin there. Like that's it. That's all the SSRIs will do. So for example, if I look at something like Prozac, right? All Prozac is going to do is, inhibit presynaptic serotonin reuptake, increasing serotonin availability in the synaptic cleft. Like that's all that will do. However, something like vortioxetine or Trintellix, right? It's got all these different serotonin receptors. So it hits the 5-HT1A, 5-HT1B, 5-HT1C, 5-HT1D, 5-HT1-7. So because it hits all of these receptors, they help fine-tune the serotonin release. So it doesn't just release it, but it modulates it. It's kind of like these are like little channels that like tweak the serotonin, as opposed to it all just being spammed out. So that's the difference between vortioxetine versus just a SSRI. And that's really the difference with that's really the difference between someone who really understands psychopharm versus someone who does not. I ask because people get diagnosed in mental health, and I assume that went for the psychic thing, right? Yeah. Yeah, I think everyone's different. I don't really judge. The only way you judge if it's a mental health thing is if it causes distress to the patient. People are allowed to have their own beliefs. That doesn't make it a mental health. Yeah, Piglet, all the information is in my bio, so you can check it out there, or you message me. Or just send me a message. I'm on Abilify and starting Effexor tomorrow. How are they together? Could be a little bit stimulating, but you can pair them together. It's not a big deal. I'm a pharmacist who sees a Psych NP. Now I'm wondering if they're not qualified. Lol. No. Oh, rip, my can thing dropped in my water. But that doesn't mean that. Everyone gets coaching. I mean, I get my own coaching. Right? Everyone has learning. So, like, I learned psychiatry. I went through residency. So, just like I learned, I teach other people. You know, I have business coaches, and, like, they learn from each other, right? So, just because somebody's learning, it doesn't mean that they're not qualified. Favorite food? Salmon. Probably just, like, protein. Yeah. Why don't people with schizophrenia ever want to accept their illness? Because there's psychosis, and psychotic means it's a departure from reality. Hi, I started Wellbutrin recently at 300 milligrams. It makes me so tired right after lunch. That's weird. Usually Wellbutrin's not really tiring. It's more energizing. Psychosis, scamus, schizophrenia. No, psychosis is a symptom of schizophrenia. That is the difference. It's like psychosis is a symptom, which is a departure from reality, which can involve hallucinations and delusions. And it can happen in bipolar. It can happen in schizophrenia. It can happen in like a steroid thing. It could happen with substances. So all of the above. Thoughts on lion's mane? It's okay. I've never prescribed it too much. I prefer ashwagandha personally, but lion's mane is like a more of a cognitive enhancer, so that's what it's used for cognitive enhancement. A lot of entrepreneurs and stuff use it. Dr. Ketchy says, do you have your own practice? I do, yes. Yep. So I run a completely telehealth practice online. Does a psychiatric technician job look good for grad school applications? Yeah, I'm not sure about grad school applications because I went to med school, so yeah. Abby asks, what is ashes? So ashwagandha. So ashwagandha is a supplement that helps with stress and anxiety. Normally like 600 milligrams is a good one. Good dose to take. I feel like lion's mane helps me focus and study so well. Yeah, it's a lot of entrepreneurs take it. That's where it got like really popularized. What can I do for anxiety? Yeah, so as ashwagandha, as I mentioned, yeah, basically ashwagandha is what you call it's a adaptogen, and it helps decrease the amount of cortisol, stress hormone in your body. So it's not something that kicks in right away. So it's not like a benzo or something that just boom, it hits, but rather it develops anxiety benefit over time. How do you classify bipolar disorder? Do they need to have daily episodes? How can the patient recognize? Yeah, so bipolar disorder, basically it's divided into 3 different categories. So let me draw it out. But where'd my notebook go? Rip. Oh, there it is. Actually, I think I drew it out yesterday too, during yesterday's live. So basically, bipolar is divided into 3 different. So there's euthymic, and then there is the manic episodes, and then there's euthymic, and then there's depressed episodes, and then euthymic. So basically, it just goes in these like step-by-step episodes. That's how bipolar works, and it happens over the course of like weeks and months. So the patient recognizes by experiencing a departure from their reality, from their like normal baseline, and usually it's like they'll not be sleeping as much, having more energy, doing more risky things, especially if they get in the manic episode stuff. Physician assistants versus nurse practitioners. Yeah, so PAs go through what's called a PA school. And so their training is more medical. NPs go through the nursing route. They become nurses first, and then they go the practitioner route. So they have different backgrounds and different like ways of conceptualizing patients. So that's the difference. Can schizophrenia ever be cured? It's not really a curable condition. It's one that you just more manage. And you manage it with antipsychotics, and I'm a proponent of the keto diet as well too. Thoughts on ECT? ECT is good. It's really good for people who have not gotten good treatment results from some stuff that they've done. That's what it's good for. Like if they tried a couple antidepressants, they didn't work, that's what it's good for. Also catatonia and depression too. And bipolar. Is schizophrenia an episodic disorder? It is, yeah. So there's like always a baseline level of dysfunction, but then there's also episodes as well too. How many years have you been practicing? Yeah, so since 2019, that's when I graduated med school. What are your thoughts on TMS? That's good. TMS is solid. I like TMS is basically like a less invasive version of ECT, but it's less strong too. So it's I would try TMS before ECT. My mind won't let me sleep. Would you recommend a psychiatrist? Yes, definitely. Does EMDR actually work? Yeah, I've had a lot of patients get success for it. It's good for trauma. When diagnosing, does the length of psychosis matter? Yeah, of course. It definitely matters. The length of psychosis makes a huge difference. So there's 3 different categories. When it comes to psychosis, there's brief psychotic disorder. So let me draw this out here. So basically, there's brief psychotic disorder, which is like from the 0 to the 1 month. And then if you go to 1 month to 6 months, you get to schizophreniform disorder. And then once you get from 6 months onward, then you get to schizophrenia. So basically, that's the difference there. So yeah, it does matter. What are your thoughts on Rexulti? So Rexulti is brexpiprazole. Basically, it's like an Abilify. That tends to be a little bit more cleaner, right? So that's the difference there between Rexulti and brexpiprazole. So yeah, usually if brexpiprazole is a little more expensive. I actually just made a lecture on this too, so here I'll pull it up. It's a little bit more expensive, but it tends to be tolerated a little bit better too. How do I reverse this? I feel like a boomer. Yeah, so this is my Rexulti lecture, the brexpiprazole one. And so if we look here, right? So pretty much it's a dopamine serotonin system stabilizer, right? So it's very similar to Abilify, but just less akathisia, less agitation. So I just think about it as Abilify with a little bit better side effect control, but it might hit the dopamine receptors not as hard either. So that's the difference. What are the pros versus cons of PA versus NP? They're pretty similar. Yeah, I can't really think of too many like pros and cons. They're very similar. They have very similar roles and similar like years of training too. Yeah, there's definitely differences between uh, like a full-fledged psychiatrist versus the other two. Usually the PAs and NPs tend to work in a supervised role and tend to need collaborators compared to MDs, but there's a lot of shift for independent practice that's happening as well too. So yeah, that's where the movement is. So actually I did a good interview. Well, we had it with 2 other NPs. So you can definitely check out that interview too. It's on my YouTube channel. So if you go to my YouTube channel, I interviewed 2 Psych NPs, so we discussed all of this, and we discussed all of the pros and cons of their training too. So that's the place to really get into it. Even as an NP, I will always consult with the psychiatrist, and that's good, because the only way you learn is from collaboration. So, and you learn from mentorship. For example, the benefit I had when I was in residency was I had 4 years of supervision from an attending from all of my cases. And that really helps, because that's direct mentorship. You can't learn from books. You can't learn from just reading stuff online. You have to see real cases, get experience, and you have to have a coach or a mentor correcting you each step of the way, so you know which direction to take. Yeah, one cannot deny the framework and approach towards medicine. Yeah, Abby, are you a PA or NP? Are you a provider? What are your stats when applying to med school? I mean, I did it over 10 years ago, so it's irrelevant now. Is it worth going through schooling to become a psychiatrist? What do you think about the PMHNP route? So it depends. If you are just an undergrad, and you're hard set on becoming a psychiatrist, and you have to go through the full thing, right? You have to go to medical school. Whereas as an NP, you go through nursing school. So my question is, do you want to be a nurse and be operating in that capacity? Or do you want to be a physician or a doctor and operate in that capacity? Because that's what you have to do first and foremost. And then, you go on from there. So, for example, to become a psychiatrist, I had to go through medical school. And to become a NP, like a lot of my students, right, they had to go through nursing school. So that's the difference there. And it's a different skill set, it's a different level of training. My PMHNP program has OSCE hands-on site training throughout the program to ensure we know. I mean, OSCEs are not like, OSCEs don't mean shit. That doesn't mean anything. OSCEs are just like standardized clinical assessments. It's like real patient cases, like the complex stuff when the patient has like 5 different comorbidities, and you don't, once you get in the real world, then you will see like, holy shit. Like, for example, like the cases that my students bring to me are so complex that I'm like, holy F, like these are really tough cases. And the only way you learn is from collaborating and like discussing it with mentors. Like, those are hard cases to navigate on their own. Yes, exactly. So that is the thing, right? It is frustrating because NPs are in the nursing mindset, very rule oriented. Yes, so it's a different kind of mindset, right? So the way to really think as a provider is that you have to look at the whole picture, and you have to assess the patient from, okay, the pathophysiology, what's happening, from a medical model, what's happening, and then address, okay, what the treatment plan is based on your interpretation of the patient. Whereas if you come from a nursing background, you have to switch your ideology and thinking from accepting and following orders to now actually thinking critically and thinking deeply and thinking a lot more comprehensively. So it's definitely a mindset shift, and knowing that underlying pathophysiology is what's going to make the difference, and that's what's going to make you an outstanding provider versus just a average provider. Because if as a provider you are the leader in the patient's care, like they're looking to you for your clinical expertise, and instead of just following the order where you know that if shit goes wrong that it's not on you, as a provider you have to adopt the mentality that, yeah, if shit goes wrong it's on me, because I am the one who's making the decision. But then to make a decision like that, you have to become confident. And how do you become confident is that you get competence. So you have to develop the clinical competence, your skill set, so that way you do get the confidence. So for example, like in residency, we had 4 years of supervision. And so, at the beginning of residency, when I would see patients, I would be like, okay, do I do this? Do I do that? Like, I'm not sure. But now, 5-6 years later, I'm like, okay, I know what to do. And I feel confident that a patient, if they come into my office, that I can help them, because I've developed that confidence, that clinical confidence, from the competence of all the years of training. So that's the difference, and that's what I try to teach my students too, is that, right, that I'm trying to help you develop that confidence by developing your clinical competence. That's the whole goal of my program. Yes, and the best way to do that is in my bio, or just send me a message. It's good you do that with coaches. Is it common for all psychiatrists? It's not, no, but I'm not your average psychiatrist. I'm also going to the American Psychiatric Association conference tomorrow, so I'm excited. I'm really interested to see how things will be. I've almost all kind of been out of touch with like other psychiatrists, just because I'm doing online work and like full on business private practice, whereas most people are working like standard jobs. So it's just different. Is there a big difference between bupropion X300 XR versus 150? Yeah, there is actually. I find that 150 is like a good kicker, but then 300 is like usually a good. It's like a good stopping point where patients like, oh yeah, now I notice the difference. For example, I have this patient. He's a CEO, and I have him on Wellbutrin because he has trouble getting up in the morning and getting focused, and there's mood issues too. And so he says, yeah, 150 was helpful, and then 300 we upped it, and he's like, oh yeah, like now I definitely notice the difference, and he's a lot more ready to go. So there's definitely a difference. 300 is a good sweet spot for a lot of people. Yes, confidence comes from competence. Do you have advice on Zyprexa weight gain? Yeah, actually I made a video on that before, but basically you can use things, I mean, if you want medication-wise, you can use metformin, you can use GLP-1 agonists, topiramate, those are things that we can use farm-wise. In terms of diet-wise, right, you just want to make sure that you eat healthy. I always tell patients, get rid of all the junk food in your home, because that's what's going to tempt you. Get rid of all snacks and other things, so that way you just don't have them. Control your environment, and just make sure you eat full, filling whole foods like protein and vegetables, rather than a whole bunch of carbs, because that will make you hungry and mess up your blood sugar. How do you feel about the clozapine program getting shut down? It's good. I'm really glad. It's not. It didn't get shut down. It's just it was just overkill. You still have to do the monitoring. You just don't have to report it. And clozapine is a good medication that helps people, like treatment-resistant people, and it's being underused because of like the strict monitorings. Does the keto diet help with certain disorders? Yeah, it helps with seizure disorders, bipolar disorders, and schizophrenia as well too. No, the program's not changing for clozapine. Basically, they're just getting rid of the reporting requirements, so you don't have to report the REM stuff, which is really good. Because that's just annoying and it makes people not want to do it. What are your thoughts on Effexor? Effexor's solid. Yeah, it's good. It's a definite heavy hitter for sure. I think it's a little bit stronger than SSRIs, but the withdrawal is the hardest part about it. Why do I look like I'm about to cry? I'm not looking. I don't feel like I'm looking like I'm about to cry, but I am tired. But hey, we keep pumping. Is water diet healthy? I'm not sure what that means. Like I eat what? Like only water? I wouldn't do that. But yeah. Have you done loxapine and cyproheptadine combo for patients who don't comply with clozapine blood work? No. No. You generally know who's a good case for clozapine before you prescribe them on it. Any diet recommendations for those with ADHD? Yes, protein. Eat protein. Protein becomes tyrosine, which is an amino acid, which makes dopamine. So you want to eat high protein, low carb. Regarding Wellbutrin extended release, but people like notice an onset of action. Yeah. So there's a curve, right? So with all the medications, you have the curve where the dose concentration rises and then it falls, and so with the immediate release meds, the dose rise and fall is a lot more quicker. But then with Wellbutrin, and Vyvanse, for example, the dose rise is still slower, but it still rises, so that's why people still notice the onset of action. What is best for, can't say that word, but the ED? I mean, they definitely need to have a lot more structured care. Like, so if you have the ED, right, you need a lot more structured care, family-based therapy. Prozac is helpful too. Yeah, family therapy. Sometimes you need a structured ED program. Sometimes you need inpatient. Yeah. My throat's dying too. Can you supplement tyrosine like vitamins? Yeah, you can. But it's not the same as eating a higher protein diet. Best way to heal from Vyvanse's use. I'm off of it. Yeah, just give it time. Eat high protein again, so that way you can regenerate your own dopamine. Would you recommend Wellbutrin to supplement my Effexor if I've been diagnosed with ADD previously? Yeah, Wellbutrin can be helpful. I would just be careful of this. Those two can be very stimulating together. Thoughts on low dose naltrexone for mood? It's more for inflammation than for mood. I'm on Venlor 150. I assume you mean venlafaxine. Yeah, it's a solid dose. I have some patients who get to 150 and they're like, okay, I'm good here. I'm going to stop. So that's pretty good. Psych benefits to saffron. Yeah, mild anxiety and depression, it can be helpful. What's the protocol for an elderly patient presenting to the ED with confusion? You do a UA, urinalysis, you do blood work. You make sure that they are in a quiet, safe room, not many lights and distractions and stuff going on. Make sure there's, not a lot of stimulus, and then you try to investigate what the cause is. What SSRI helps with OCD? They all do, but Luvox is the one that's like super approved for it. High dose Luvox, yeah. There's something I saw that was good. Something about Clozaril, smoking. Yeah, basically, smoking will reduce Clozaril's dose, so that's why you need more. What's the rarest illness you encounter? Probably like a delusional disorder or DID. Yeah, I mean, I've only seen like 2 cases of DID, and those are in more acute, intense settings, right? So like I saw one DID case in the community mental health setting, and then one in the inpatient psych setting. Is sparkling water good for the kidneys? I mean, it's fine. I drink mainly sparkling water, but I like it for the appetite suppression, and I just like the carbonation. Yeah, I just got on sparkling water, then never went back. I mean, don't get me wrong, I still drink normal water too, but yeah. So, okay. Looks like, we've been live for about an hour now, actually. So I think now is a good time to call it. So thank you for tuning in. If you are a PMHNP, right? If you're NP and you want to learn psychiatry from me, you felt like your education was not good, you felt like you didn't learn as well, your program didn't prepare you, your job's not preparing you, your collaborating psych is not paying attention, and you really, you enjoyed learning from me, and you really want to boost your clinical psychiatric expertise and really boost your confidence, then definitely check out our coaching program. And yeah, so you can send me a message or just look in my bio. And if you're a patient and you want to work with me, best way to do that is to book a consult, also in my bio, and then we can do that and we can see if we're a good fit together. Otherwise, yeah, thank you for tuning on. I'm not sure how my live's going to be over the next 5 days because I'm at the APA conference and I have no idea what's going to go down there. It's going to be a lot of networking, a lot of connecting. So I don't know what my schedule is going to be, but I'm going to try to hop on as much as I can. Maybe during the conference, so maybe during the daytime, because I'm sure there'll be other like social media docs and stuff there too. So maybe we could do like a joint live, or yeah, or at night. But otherwise, yeah, I shall see you soon.